Yeah. So I used to go co-clubbing with Anna before. Except I can't, so I'm going to that. Yes.
Okay. My name is Tessa Watkins. I'm an adult, I'm autistic, and I'm also a parent. I have PDA profile and more words.
My name is Liz. I'm an LPC. I've been working as a counselor since 2015. I started working with men who were seeking re-entry from incarceration, and there I spent a lot of time working with trauma and neurodivergent adults as well. From there, worked in private practice for a bit, and then went on to open my own practice in 2023. Eclipse Counseling, that specializes in working with neurodiverse adults.
So today we're talking about PDA. PDA, Pathological Demand Avoidance, also known as Pervasive Drive or Autonomy.
Yeah, so PDA was first discussed in 1980 by Elizabeth Newson, who is a psychologist based out of the UK. But it wasn't formally published about in any peer-reviewed research until 2003. So right now, the state of research on PDA is not very robust, and the studies that do exist, some of them aren't the best quality. And so that's one of the major reasons why we don't see PDA as an official diagnosis. It is not in the DSM, which is the diagnostic manual that we use here, or the ICD, which is the manual that's used globally. And so we will be approaching PDA with the understanding of it as a behavioral profile rather than a diagnosis. To clarify a little bit more about what a behavioral profile is, basically we're just talking about a cluster of symptoms that exist within a neurodevelopmental disorder. And so with PDA, research shows that it's most common in individuals who have an autism diagnosis. So about 1 in 5 individuals with an autism diagnosis show some characteristics of PDA, while about 1 in 25 show all characteristics. But it's not just limited to autism. So people with other neurodevelopmental disorders, especially ADHD, can also have characteristics of PDA.
So the reason why it has two names is because the first original name was really clinical, pathological demand avoidance, and the people that particularly identified as, having PDA or being PDA, we preferred a more positive approach. The word pathological, a lot of common folk usually think of pathological liar, so there is a really negative connotation with that. So with pervasive drive, kind of remove that. And essentially pathological demand avoidance, avoiding demands, that was more like a symptom or a response and not what we actually experienced. So we wanted it to be more like internal and described, who we are, a little bit more about us, as opposed to like just one piece of it, one symptom or one, behavioral response.
So one thing I also want to take a moment to address is the difference between PDA and ODD, which is oppositional defiance disorder. So in the United States, we have ODD as a diagnostic option within the DSM. And so a lot of times people who fit some of these characteristics of having a PDA profile will receive a diagnosis like ODD because that's kind of the closest aligned thing that's available currently. The difference being though is that with PDA, change across contexts. So typically they're triggered when there's a perceived demand that's introduced, whereas with ODD, it's a lot more consistent across contexts, and so that's one of the big defining factors. In terms of characteristics, the language here reflects more of the deficit model, which Tessa kind of addressed with like the two different names. Because a lot of this language comes from the research that was done under the name of Pathological Demand Avoidance. So for people who have characteristics of PDA, demands can be conceptualized as a threat to autonomy, and they can trigger an anxious response. And that anxious response often leads to behaviors that act as a way to kind of regain a sense of control. There can be avoidance of everyday demands, and these demands can be direct demands, so something like, brush your teeth, do your homework. They can be internal demands, so sometimes individuals with PDA have difficulty with things like responding to hunger cues or cues to use the restroom. And they can also be more indirect cues. So examples for like adults with PDA, paying bills, having to buy groceries, so things that like you kind of know you have to do, but aren't being explicitly asked. As far as social strategies, a lot of times we see individuals use tactics like distraction, negotiation, or kind of like blame shifting to deal with their demands. And the social strategies are one element that a lot of the research says really differentiates PDA from traditional autism in a way, because with traditional autism, we often think of like censored social deficits. And so we think of those individuals as oftentimes not being like socially skilled, whereas individuals with PDA are seen as being pretty socially skilled in this area. Also, there's what they call surface sociability with underlying social difference. And what they mean by that is that oftentimes an individual with PDA can come across as completely sociable, but sometimes they struggle with maintaining deep relationships and forming deeper relationships. You'll also see role play and fantasy as regulatory tools. And for some kids, this especially can play out as taking on the role of an authority figure. So you'll see like kids in a school setting that maybe take on the role as a teacher with other students, or kids in the home might take on like a parent role with their siblings.
Unscripted tangent. My 7-year-old last night didn't want to go to bed as usual. So I was testing this presentation on her, she didn't want to go to bed. And one of the things she asked, I asked, like, do you know what PDA is? And she's like, no. So of course, glad you asked. Anxiety-driven need for control. And she's like, what does that mean? Like, well, you don't want to go to bed. You want to stay awake. You want to have control of this situation. You don't want me to tell you to go to bed. And of course, she's, just generally avoiding going to bed. She asked to use my phone to text her friend Sydney. And I'm like, no, it's like 9 o'clock at night. She's 7. And she asked if she could text Daddy, and he's just in the basement, you can just go down there, because he was also working. And then when I got to this part, she's like, no. So she, I don't know what happened after that, I kind of forget, but she left the room and stopped bothering me, so. But, because I think I talk too much, and this gets her stops. So part of with PDA is I want to explain just some base theories that some of my friends and colleagues in PDA have come up with. A lot of people are probably familiar with spoon theory. It was created by Christine Miserando in 2003, so it's been around for a while. And my interpretation of her spoon theory is that it's based on energy and how its energy is spent. So the concept is that each spoon represents just some arbitrary amount of energy. It's non-specific, so you can spend those spoons however you want, but you do have a finite amount of spoons. So people that are disabled will probably have less spoons than people who are not disabled. And when we have to choose between what we want to spend our spoons on, we've got tasks like laundry, playing video games, and doing the dishes. Now, they also have costs associated with these. So these are, my interpretations of costs, because I really hate doing the dishes, and my husband, when he's on the slides like that, makes sense that you put it at 4 seconds. Because I don't do that. I actually do this like maybe once every 2 months. But this, I do that a lot. I love my craft. So we get to choose where we spend our spoons. If I actually had, this amount of spoons, there's no way I could do both laundry and dishes, obviously. But I have time for video games. In fact, I have enough for video games to do, again, more. But with spoons, point that way, they can be refillable if with self-care, like take some medicine to help with your back pain, take a nap, sleep through the night, anything you can do that is self-care, that is how you can get your spoons back. Or not, sometimes they just don't work. That sucks, sorry. It's not getting done. My husband's the same. So then we have ticket theory. It's a bit newer, and it's by my friend Hillary Knudsen. She created this one in 2021. And it's based on like carnival tickets. Like you've got tickets that you go to ride the Ferris wheel. You've got tickets for the merry-go-round, the Hall of Mirrors. I like to think that her tickets represent motivation. It's more internal. So we have the energy that is the spoons, the tickets that are motivation. With motivation, you don't have a choice. If it inspires you to be motivated, like that happens whenever it happens. You don't get to choose when that happens or how it happens. They are also specific. I can't choose what they are for. So if I have a ticket for laundry, I'm motivated to do laundry. I'm in a cleaning mood, good for me. If I'm very, motivated to play video games because I have an idea for a build for an automatic farming Minecraft, I'm going to have a lot of tickets for that. And maybe let's hope for a ticket for washing dishes. This is kind of that like have motivation all the time, of course. But the tickets will expire if they go unused. So if I'm, I have them in the mood for cleaning, but let's say I happen to be on vacation for some reason and I'm not even home, I can't clean my house right now. I clean this weird apartment place that I'm in. I clean other people's houses, I've done that. I think it's a weird phenomenon that's kind of relatable. But anyway, that could expire because then my house still doesn't get cleaned. But also you can do shareable tickets. They are non-refundable, non-transferable, no cash back, but you can get shareable tickets if you have someone that's willing to body double, or if there just happens to be something, inspirational from somebody else that can help activate your intrinsic motivation. External motivation, but do we have to choose between the theories? No. I think overfit. I like the idea that we can have our spoons and our tickets, spoons being the energy, and tickets being the motivation. So if I have a ticket for folding laundry, awesome. And I have spoons for awesome, spoons for folding laundry, double awesome, because then laundry's actually gonna get done. That happens once. If I have a lot of spoons or tickets, I have to kind of choose. I don't have enough spoons for washing the dishes, but I am in a cleaning mood. I want to wash the dishes, but I can't. Sucks to be me. But I'm gonna sit and play video games for 2 years. Or I mean 2 minutes. 2 years. So this, when it comes to PDA, I feel like this is accurately reflective of me. I don't know about everybody else, but at least me. And a lot of the challenges with PDA is when this scenario is switched. I might have the spoons, but I don't have the motivation. And if I was a kid, or if I was just my husband's wife, he would say, why did you play video games when you could just wash the dishes? I can't. There's like a pull, the motivation for me, it's like hyper-focus. I just can't, I'm so drawn into, like I cannot think about anything else, and unless I can get like this step out of the way, it's like a mental blocker, I need to move that step, complete these tickets, hopefully before that ticket expires. And I think like the amount of tickets also helps me like identify how strong of a pull there is in my mind to do something, to do a specific task. So I might be in a bit of a cleaning mood. Maybe I'm specifically in a cleaning mood for the kitchen and never the bathroom, which is why we have a cleaning space. So we have our stages of a PDA. I'm gonna give it to Liz to talk about some stuff. Or was this one mine? I don't know what I'm script there.
I think it's both of us. But yeah, so basically what we try to do is break down a PDA episode into stages, just to help with understanding and also recognition if you or someone that you care about is dealing with PDA. And so the first thing that happens is a trigger. So this is typically when a demand is introduced. So again, like I said earlier, it can be a direct demand, it could be an indirect demand, it could be an internal demand. So once that happens, the volcano kind of starts. Everything starts rumbling.
So like the direct demand, there was, usually it's someone from a person that just directly asks you, let's do something. For example, I was in a cleaning mood, I don't know, 3 months ago, and then my husband was at home, so that's probably why. And when he did get home, he said, wow, you did such a great job. You think you could do this one part? No, nope, I'm not gonna finish it now, you asked. You acknowledged me, you perceived me, I don't want that. So now it's just, nope. The indirect language, he is British, so he's very polite. So he'll things like, it's getting cold, isn't it? Yes, it is, sir. It is cold. What do you want me to do about that? I don't know, I can't guess what's in your brain. So using things like hinting, if you're a person that understands like, guesser culture versus asker culture, I am definitely asker, he's definitely guesser. Things like that, that's like the indirect, like I'm trying to imply a demand, or I'm trying to say a demand, but without saying it. Then finally, the internalized one, that one is when you put demands on yourself. Nothing else is out there, but it's also like perception, perfectionism, some of those weird goals that you set for yourself, like my favorite one was the speed limit sign. Sorry, I pulled it too many times. But it was actually while I was thinking of what to say for this kind of stuff, that I drive my kid to school, and on the way to school they have one of these stop signs, not stop signs, the speed limit signs with the solar panels that just tells you how fast you're going. No other context. Now, I think most standard issue brains would be like, oh, this sign is telling me to slow down because it's acknowledging that I'm going too fast. Because there is subtle indications that if it's blinking, it means you're going faster than the speed limit. If it's just a steady speed, or if it's just a steady number, it means you're under the speed limit. And it does not acknowledge the margin of 10 miles of over. But that's not what I think of that when I see that sign. I would pass a sign, I'm like, you're telling me it's 25. No. I am intentionally gonna drive exactly 26 miles per hour this entire way, and I'm gonna tell you what to say, little sign. I mean, it could be 30, could be 20, I don't care. I just choose a number before I see that sign, and I'm gonna tell that sign what it's going to say. I'm not gonna let it tell me what it says. And then one day, it stopped working. And I was just angry. It was like, my kid has no idea what's going on. And I'm just like, and as I'm turning the corner, I'm like, why did I just get so worked up over this stupid sign not working? I had built up this relationship with an inanimate object. I don't know if standard issue brains do that, but I do that. And that relationship, our rules for engagement were violated because it stopped working. So I got angry and that triggered, and that went through the whole stages of this PDA we'll get to. It was very speedy though, because I'm an adult with coping mechanisms and was able to do all of it within the drive to school, but not as good.
The next stage we describe as kind of the swell. So this is when things start really heating up. This is when the anxiety really starts to rise. And so this is where we might see some of those, like what they describe as like social avoidant behaviors start to come in. We might see like some reflecting, some distracting, stuff like that, just to try and take some of the heat off of the situation, try to, in a way, like prevent the eruption.
I feel like the swell, it is the one that makes the biggest difference as you get older and you mature emotionally from childhood to adulthood, and just in general, because as a little kid, this swell, like, I would go from 0 to 60 like in an instant. I see my kid, she goes from 0 to 60 almost instantaneously. But she's been in OT she's 7 now, she's been in OT since like 2.5. So she's got a lot better coping mechanisms than I did back then. So she now goes to 0 to 60 and maybe like, I can sometimes mitigate it, not always. For me, I have a whole mental gymnastics that I performed during this process. And it wasn't even just mental gymnastics. I also take medication to help with this fight or flight reasoning. So before, I would feel like it was just, I only knew like 2 emotions. I would be like angry and not angry. Of course, like the other emotions too, but like on the angry spectrum, it was just rage and normal. When I started taking medication to help manage my explosive emotions, because when it comes to fight or flight, I am fight. So is my child. The other violent autistics that will never punch people, bite people, scratch people. I haven't bit anyone since I was 18, except my kid, that doesn't count. I did bite her once. She deserved it. But with the swelling part, it was with the medication. So what happened was that I started to actually feel a spectrum. And when I would, during these moments of, when we get to like the next part, the actual explosion point, a lot of times I did not feel in control. I often felt like, you know, here's this body that is just screaming, shouting, kicking, doing whatever, and like my consciousness was just kind of back here, just like existing. It didn't actually have any thoughts or feelings, it just existed. And as I got older, this onlooker actually started to think, hey, this isn't cool. You know, I was starting to actually separate myself from myself. I don't know if that makes sense. But it was in a sense where I was actually starting to also feel more and more time during the swelling. So I could feel irritation, I could feel upset, I could feel disappointment. There was more ranges to my emotions other than just rage and not. There was a whole spectrum that I had never known before. And then the explosion time, because I do it occasionally, maybe once or twice a year now, if I get to an explosion point. It's not as, I can say it's not as destructive. It's not as destructive because I am slightly more in control, but I feel like this bystander observer consciousness is starting to evolve, and it's something that I've been talking with my therapist in that, you know, now this person in the back, it's like they can, for the first time they actually spoke in my mind. I don't really think in thought, I have visuals in my mind, but like for the first time there was like, you know, thoughts and feelings, like an entity forming outside of this rage monster. And during that time, like the last one I had, it's like, why are we doing this? And one of my mantras at home to help bring me out of this is, we don't hurt people we love. And that was one of the things that this person that acts like, we don't hurt people we love. Why are we doing this? Why are we angry? And it allows me to start into the next phase, which is where we collapse before we finally reach into the resolution, which is that the resolution that is like long after the moment has passed, and now we're actually trying to heal and learn from it, because you can't do that while you're pissed off. That's not a burning brain. You can't try and teach kids while they're screaming at you. You need to make yourself safe, make them safe, write it out if you can, you know, use whatever tools and strategies you have, and then resolve the issues after.
Yeah, so with the explosion point and collapse, I think of those within terms of like the meltdown shutdown model. So within like autism research, there's a lot of talk about the way that autistic individuals experience like extreme emotions, extreme situations, and there's talk about one of those being kind kind of the more outward behavioral meltdown, which is something that's like very observable, you can see happen, and then more of an internal shutdown, which is the individual going more inside of themselves to cope. And so with someone who has PDA, often you see a little bit of both. You see kind of more outward behavior, which is like the explosion. That's where, you know, there's like maybe crying, maybe there's yelling, like there's just kind of physical reactions. Yeah, so, and then with collapse, it hits a point where like the explosion point, it kind of burns out. And so there's so much energy that goes into hitting that explosion point that there's kind of a come down here with the collapse where, you know, not only is it the more inward experience, and sometimes it's also related to shame and guilt that people feel from experiencing the explosion point, from having people witness that also can cause people to turn inward into the collapse. And with resolution, yeah, like Tessa said, that's one really important point, because I think sometimes when you're, especially like in the moment with a kid, when you start to get here and here, sometimes there can be temptation to try to find resolution, to be like, okay, what do you need? What can we do? Like, can we resolve this? Like, is everything okay? Once we hit these points, it's a lot more helpful to kind of reduce verbal demand when you're trying to support someone who's having an episode, because that often takes a lot of energy for them to respond verbally, to like interpret verbal commands, verbal input. And so just kind of holding off on that stuff until resolution, which is, you know, we want to wait until with that, like both parties are regulated. So it's definitely like a two-party event. So making sure that both people are regulated, both people are ready and willing to engage, and then working on resolution from there.
And intentional.
Yeah.
I don't want to forget about that, because then you just repeat. I'm actually going to see if I can hit the reverse button, because I told it from my point of view internally. I'm going to go through it again, but as a parent, watching my 7-year-old going through this. So we have various triggers, but when she's swelling, this is like the critical time where I know that her lizard brain is going to take over, her hormones, she's pumping out adrenaline, and she's got very, very short time before those hormones overwhelm her brain and she's just going berserk. So this is not the time to bargain and demand more. This is the time to just completely de-escalate. And I had to explain this to my husband because he thought it was permissive. Like, it's not giving in, it's really just validating. You know, I'm not gonna say, like, the classic is, she wants a stuffed animal from Giant Eagle every time we go. I'm gonna say, well, I say no like 80% of the time. And she's, you know, has been on the times when she's gone on the floor, but that's the floor, it's the explosion point, it's the time before she gets on the floor that is the swelling. And I say, like, you know, I don't say you're not getting it, or I say let's get it instead. The solution is not getting the stuffed animal. It's, hey, I know you really want that stuffed animal. It's pretty cool, huh? You know, let's acknowledge that the stuffed animal is pretty sweet. I'm like, let's take a picture of it with my phone and see if we can buy it later. You know, just let's, you know, acknowledge it. Let's, you know, so I see it's upset. You know, just kind of, just do what we can to de-escalate, but not giving in. And the explosion point is that if I ultimately fail, because other things like saying we're not getting it, the answer is no because I said so, that just escalates it, so that reduces the amount of time she's in swell, and she's just gonna go straight to the explosion point. Then you have a kid on the floor screaming, crying, and people staring at you. Most people just don't care, and they're like, oh yeah, we've been there before, but you internalize that as shit. So explosion point sucks for everybody involved, even beyond Livers, because she has quite the scream. And then the collapse part, because I know that collapse feels a lot like shame, because that's like the moment where, you know, you're this consciousness come back to being in control. You're like, wow, I am a monster. I am worthless, I suck, I don't deserve to live, I don't deserve to do any of this stuff, I must be scary, nobody should ever see this side of me, I should just hide in the hole. I know that's what she's gonna feel even at 4 years old. Even if she doesn't have words for it, I know that she wants to disappear. And one of the things that I've made sure to do is I can tell kind of like when a cat or a dog barks and meows and they're your pet, and you know the differences between their meowing for love and meowing for food. I can tell the differences between your screaming for pain, screaming for anger, screaming for excitement, screaming just to scream, and screaming out of sadness. Very distinct screams. So I've become an expert in my own child's screams, knowing when she goes from angry, I'm going to murder you scream, to I'm actually kind of sad scream. They become a little bit more sluggish, a little less destructive. Like at this point, she's no longer throwing chairs on the ground. She's just kind of like picking things. She's no longer trying to attack me. She's kind of given up and sitting. She's no longer slamming. She's just kind of laying flat. It's just like these behaviors where like she's now lost the energy to be this destructive, and she's now this like going inside, the collapsing inside herself. And I know at that moment, it's like, I need to make sure she feels loved in this stage. And because I know she's thinking she's a monster, I can't let her think that I'm going to abandon her. You know, I need her to know that I'm not afraid of her, and that I'm not afraid that she's gonna scare me away. So in this case, especially in situations where she is attacking me, you don't deserve to be attacked. You know, it's your body, you don't deserve, like, you're not their punching bag. So it's okay to separate yourselves. And at some points, you know, when we were out to eat and I put her in her car seat to just thrash out while I sat in the front seat crying, you know, I was still there. She could still see me, but she was safe and I was safe. There's been times where she's been in her bedroom with the baby gate and she's done her thing in there, and I was on the other side of the baby gate. I was still visible, I was still there, but she couldn't get to me. You know, it's okay to protect yourselves, but still be present, because it's important that they know that they have someone who's never going to abandon them in that moment, that they are worth, you know, that someone can see them at their worst and still want them and still love them. And then, again, the resolution, it has to be intentional. A lot of the times during this collapse thing, when you go back to a reptile brain in here, she can't communicate. Well, normally she's super fluid at talking, amazing little speaker, will talk your ear off, highly articulate. But when she's collapsing, she's just like wants nothing to say. She says things that she doesn't mean, and I do too. But she'll say all sorts of things like, what do they call it, the mental assassin, where they try to like attack you through the mind, being like, I hate you. I wish your dog died again, like just dumb things like that. And I know I don't take it personally anymore. It still hurts, but I don't take it personally, because I know that she's not the one in control of it. That's, you know, this other character. I've been there, I know. But when she gets to this stage, I know she's like, well, I remember I said that. I heard Mom, that sucks. But even that, she can't really articulate anything there. So I don't start with words. I don't immediately jump, because if you jump to resolution so soon, you're gonna go right back to the explosion point. You're gonna go right back to trigger. So I'm like, okay, now do you want to say sorry to the person you bit in class? And she's like, no. So we're not gonna go back to that. It's not ready for that yet. And this time, I get down on fours, and I'm like a little puppy with, I don't know, a sock in my mouth, trying to play with her. And she's just like over on the ground, like laying there, she's like, what are you doing? Like in her mind, like she's like, you know, this sudden shift in mood. She's like, I suck, but you wanna play with me right now, what the heck? I don't talk until she talks, that's my general rule. So if she is wanting to, if she starts saying something, then I can respond. But I don't ask questions, I don't use mouth words, I just act out. That seems to work for us, at least as a little kid, for that age. I will have this talk again in about 10 years, which is a teenager, for those things. And yeah, for the resolution, it looks different for every situation. We've had resolutions, other times, I have not been above throwing Kit Kats on the floor, like the little thing to like lure out to me. And it has worked, because it's even funnier when I'm not in view and I just like, and you are just out there, she's like, so she just like, and I just like look at them, I'm just like throw another one. So it's whatever we can do to change the mood, that is kind of, you know, get, once we're regulated again, then maybe, and that could be, you know, in an hour, that could be a week from now. Honestly, I know that these things are on her mind because she's so comfortable talking with me that she will come to me days later and be like, I'm sorry I made us late for school. Dude, it's okay, that'll be like out of the blue. And then we can have resolution again, or maybe it didn't feel like it was resolved the first time, so she felt like she had to do it again. Either way, I let her leave that, because it's her experience, and I'm glad that she feels comfortable enough to tell me that, and I know it's still on her mind. Okay.
So this is a strategy that I like for kind of classifying and managing demands within a family. And so the first bucket are your non-negotiable items. So generally those are gonna be things that revolve around safety, around health. Those are things that maybe involve really strong family values that you have. So things that are super important that even if we're coming up against some resistance, we prioritize finding a way through. Next is the negotiable bucket. So these are things that we can be more flexible about. These are things that we can involve the child in, we can have more collaboration. It's not so much of like an emergency situation, like don't touch the stove. It could be something more like, okay, cleaning your room, and maybe we talk with the kid about like, where do you wanna start? What do you wanna start with today? If you had to pick one thing in your room to clean, what would it be? And then the chuck it bucket. So you're gonna have days where something is just not the hill you wanna die on. So maybe the goal is we wanna clean the room, but maybe it's, you know, going back to like kind of spoon theory and ticket theory. It's a low spoon, low ticket day for your kid. Cleaning the room is maybe just not the biggest priority. And maybe it's something you say, hey, today we can let this go. This doesn't have to be a thing. And that can be hard because I think for a lot of parents too, sometimes that can involve like a level of shame and guilt with like putting some of those things in that bucket and saying, well, we're gonna let this one go. And so that can be really a moment to just check in with yourself about any of your feelings, about things that you're putting in that bucket and how that affects you.
So, because we basically wrote a novel, we wrote all of our tools and strategies in a document. It's 10 pages long.
Very thorough.
So, just putting that out there. But yeah, it has basically a bunch of different things of like, you know, there's the brief overview stages of PDA, just, you know, in case you happen across this document and don't know what it's for. But we broke it up into different triggers and essentially tools and strategies that you can use as a parent, that you can use for yourself if you're experiencing one, that your child can do, like if you want to help teach your child, you know, these coping mechanisms, these tools that they can then try and remember in the moment. They're not gonna remember it unless it's second nature, so practice, role play, so they're gonna be able to use them.
Yeah, and just to say a little bit more about this too. So with these strategies, whenever an episode starts, it doesn't always have to see itself the whole way through. You don't always have to start a trigger and get to explosion, get to collapse, have to do resolution. So the hope is that with time and with practice, you can use some of these strategies to kind of stop things at the stage you're in. And especially with some of the child tools, these are things that won't immediately be effective, but definitely with like time and practice and intervention and reinforcement can be really useful in teaching your kids some skills to not only recognize their feelings, their internal experience, where they're at, but to also give